National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. Today, I want to talk a little bit about the bladder and a common problem people have, overactive bladder. Now, overactive bladder, it's more a symptom than it is a disease. It's typically characterized by some sort of bladder inflammation, and just like with any type of muscle or any type of tissue, typically if it's inflamed, you don't want to be stretching it a whole bunch. So what happens in an overactive bladder a lot of the time is the bladder's a little bit inflamed, and so as it fills up with urine, it wants to empty a lot sooner because it doesn't want to expand to its normal size, because it finds that will actually be a little bit painful, a little bit damaging to it while it's inflamed. And because of course with inflammation comes pain, comes swelling, and a host of other changes to the tissue, so it's not capable of expanding to its normal size. That means you're going to have to void the urine a lot more often, and with this often comes, bladder urgency, or sometimes what we'll call urinary frequency. And it doesn't necessarily mean you're going to have a lot of urine coming out. It's often, characterized by like an extreme urge to go to the bathroom. And then when you get to the washroom, there's not actually a lot of urine passed. And this is often a common sign in overactive bladder. Now, overactive bladder can be a sign of a serious condition like interstitial cystitis, or it can be something as simple as a urinary tract infection. Regardless, though, if you do have overactive bladder, you want to get it checked out. In men, it can be a common symptom of prostatic hyperplasia, so basically a swollen prostate, or which could also be caused by prostate cancer, or any other type of tumor or lesion that's blocking the urethra or blocking the bladder. So it's good to get urinary frequency checked out. It's a very common symptom, very often seen with urinary tract infections and a host of other really mild conditions, but it is worth getting checked out, especially if it's something that happens often, because there may be something more serious, especially if urinary tract infections are recurrent. Like if you keep getting them, there might be another reason why you're getting the infection, not just a lack of antibiotics in your daily routine. So if you find that you're having to take a lot of antibiotics or something like that to chronically manage urinary tract infection, start looking at other avenues. I've seen overactive bladder caused by something as simple as a food sensitivity, and removal of certain foods from the diet was able to reduce the symptom and get rid of it altogether. And again, I've also seen it, tumors causing recurrent infections. And when we started to investigate, we discovered that there was actually, bladder cancer, which, because it was caught early, was very treatable for that patient. So again, something worth getting investigated. Now, if your cause is something like a urinary tract infection, you can use things like D-mannose, which is the sugar found in cranberry, or you can use real cranberry juice. This prevents bacterial adhesion to the bladder, and it helps reduce the incidence of urinary tract infections. If you do have an active infection, herbs such as marshmallow, which can help soothe the inflammation, and golden seal, which can help treat the infection, can be very effective in managing the symptoms. However, if it's not resolving quickly, definitely go get it checked out by a medical professional, because you don't want a urinary tract infection getting worse and spreading to the kidneys, because that becomes a much more serious condition. Definitely, if you have blood in the urine, you do want to go and get that checked out right away. Now, if your problem is more prostatic in nature, so if the prostate is swollen, you'll probably want to look into something like saw palmetto, which is very effective at reducing the inflammation that causes the swelling of the prostate, and has been well studied and shown to help shrink the prostate. As well, nutrients, things like zinc, vitamin B6 and B12, those can be very effective at helping to reduce bladder urgency. So I hope this information has helped you if you do suffer from an overactive bladder, or if you know someone who does, please pass it on. If you have any questions or comments, please post them below, subscribe to our YouTube channel, and always remember, knowledge is health.